I am Dr. Muralidhar, consultant glaucoma, pediatric ophthalmology, strabismus and neuroophthalmology. I shall be talking today about glaucoma. Glaucoma has blinded 12 million Indians and accounts for 13% of blindness in India. So let us understand what disease is implied by glaucoma. We can consider the eye as a pressure pump. So we need pressure in the eye. So there is some fluid that comes into the eye and there is some fluid that goes out of the eye. So all of us have some pressure in the eye that is required to maintain the shape of the eye. So imagine the eye like a pump. So you have some fluid getting into the eye and you have some fluid that is draining out of the eye. So when the drainage gets clogged because of a variety of reasons as is indicated in this video, you get what is called glaucoma. The fluid builds up inside the eye, the pressure builds up inside the eye, and that affects the optic nerve. The optic nerve is the conducting tissue that connects the eye to the brain and is a vital part of the visual pathway. So let us understand how glaucoma presents. The most unfortunate thing about glaucoma is that it is totally asymptomatic in the initial stages. Glaucoma tends to affect the periphery of the visual field. You can have some spots in the visual field, some portions in the visual field missing here and there. So most of us would not realize that there is a defect. And that is the worst part of glaucoma, that you don't really realize that you have glaucoma until you are in an advanced stage. So let us understand who can get glaucoma. Anybody over 40 years, anybody with a family history of glaucoma, anybody with a history of eye injury is at risk for developing glaucoma. So we recommend that anybody over 40 years of age or those with a close blood relative who has glaucoma get themselves routinely checked for glaucoma. Let us understand how we in this hospital or in any other hospital diagnose, detect and treat glaucoma. We shall now be talking about the treatment of glaucoma. The treatment of glaucoma, it's important to understand that you need a lifelong treatment and an absolute adherence to the follow-up, to the reviews, to the physician advice, and also to the medication is absolutely mandatory. And this is important because glaucomatous damage cannot be reversed. We can only prevent further damage. We cannot reverse whatever damage has been done. There are medical and surgical approaches to management. There are two approaches to the medical management of glaucoma. Approach number one, you reduce the fluid formation inside the eye. And approach number two, you increase the drainage. Surgery works to increase the drainage from the eye. For surgery, we can create an artificial pathway, what is called a filtering surgery. So we create an artificial filter that drains fluid or aqueous humor from the eye and it reduces pressure in the eye. We also have the minimally invasive glaucoma surgery wherein we open up the natural drainage pathway inside the eye. It can help in mild to moderate glaucomatous damage. Very severe or refractory glaucomas would require insertion of a drainage tube inside the eye. Medical and surgical treatments are not mutually exclusive. They can supplement each other. What you need to remember is that you need to absolutely adhere to the medical advice that is given by your physician and make sure that you follow the prescriptions as and when it is indicated in your prescription pad. Make sure you do not run out of medicines and do stock up on medicines. Do not default on our reviews. Remember, whether you like it or not, glaucoma is a lifelong companion and you need to take care of your eyes if you want your vision to be preserved all throughout your life. One question that patients often ask is, can I go blind because of glaucoma? The answer is yes, you can, if the pressure is left uncontrolled. Therefore, you should regularly take your medicine. If more than one medication has been prescribed, make sure you give a gap of 10 minutes between the two eye drops. Do not stop taking the medication because you do not have any symptoms. Again, as I said, early glaucoma is asymptomatic and the damage is irreversible. Make sure you stock up on your medicine. Remember, it is your vision and it is your responsibility to take care of it.